5 things you need to know about Microtia. 1. Definition. What is Microtia? Microtia is a congenital ear deformity where the external ear is deformed and the hearing or the inner canal and the eardrum and the ossicles are deformed and not working. 2. Patient age. When a child is born with Microtia, we like to wait depending on whether there is 1 ear involved or 2 ears. If there are 2 ears involved, we can do the surgery earlier because we don't have to match the size, and we'd like to do the hearing as soon as we can. If, however, the child is 1 ear deformity, then we like to wait a little bit longer, do it at 5 or 6 years of age and 40 pounds, because then the ear has grown sufficiently where we can match the reconstructed ear to match the normal ear. Adults, we can do it any age. There's no limitation. 3. Methods. The method of reconstruction boils down to 2 choices. One is cartilage, one is plastic, and nowadays it's MedPor, which is an industrial plastic material. The standard has been for many years to use cartilage because cartilage has stood the test of time. It gives less complications and has a longer lifespan and heals well when injured. The other advantage of cartilage over the plastic is we put the cartilage under the flap so that the texture and color are normal versus skin grafts, which over time the texture and the color of skin grafts changes and it becomes lighter in color and flatter looking, like a burn skin. The hearing part also is different with cartilage versus plastic. In the cartilage, because the blood supply is good, you can do the hearing procedures before or after the external ear reconstruction. However, with the plastic ear, because the blood supply is not so good, most of the otologists who do the hearing will not do the surgery after a plastic ear, but will only do it before the external ear reconstruction because of poor blood supply and the chance of losing part or all of the reconstructed ear. Staging. The insurance company requires that we do 90 days apart minimum, and usually the standard has been 3 to 4 procedures. Now, in the last few years, there have been attempts to reduce the number of stages, but a generalization is the fewer stages that are performed, you have more complications and longer surgeries for the child or adult. 4. Results or longevity of the grafting or the ear reconstruction. If the ear is made out of cartilage and it is injured later in life, 10 to 15, 20 years, I have followed my patients, and it will heal. So a cut, it will heal. A bug bite, it will heal. Animal bite, unless it's very large. Of course, you can damage any ear, but it will heal. Whereas if the ear has been reconstructed of framework of plastic, it will tend not to heal. It will be exposed, and you have a greater chance of infection and the need later in life to excise part of the plastic framework or the whole ear, which is made out of plastic framework. Number 5, choosing a plastic surgeon. How do you choose a surgeon to perform this most difficult procedures? Ear reconstruction in Microtia is considered the most difficult of all plastic surgery procedures, and it takes a long time to learn how to be good at it. First, you need optimally a surgeon who is both board certified in otolaryngology, which is the hearing part of the reconstruction, and in plastic surgery, which is the construction of the external or outside of the ear. You also need someone who has been doing this for at least 10 years and 50 cases. Because it is so difficult, it takes that long and that many cases before you master the ear reconstruction process. These are the 5 things you need to know before you select a surgeon for microtia surgery.
Go.
Dr. Jones is board certified in both the inner ear surgery and the outer ear, or the aesthetics of the ear, at the best institutions in the world: Johns Hopkins for the inner ear and Stanford University for plastic surgery, or the outer ear aesthetics. In addition, he has over 30 years of experience in performing these surgeries, or if you will, he has performed over 500 microtia surgeries. In terms of complications, Dr. Jones believes that it is very important to get the microtia surgery correct the first time instead of coming back for repairs and fixes over the years. Dr. Jones has an incredible complication rate of under 1%. In addition to his training in the United States, he has been trained in physiology at Oxford University in England and in plastic surgery on a Fulbright fellowship in Paris, France.